At first, it was really hard to sleep at night. You know, there was just so much anxiety, so much unknown.
I never thought I would ever find myself where trying to serve humanity would be a life-staking endeavor.
I just try to treat all my patients like I'd want to be treated and or I'd want my family to be treated, and I definitely cried a little bit.
I just try to keep to myself and just eat and go to sleep and do it again the next day.
Other than that, if we get coronavirus, fingers crossed, things turn out well. And if not, again, we're part of something greater than ourselves.
The first time in April when there was a major surge, I walked in through the halls of the intensive care unit. It was like a foreign land. It was like a movie. I walked into this ward and every single person is wearing protective gear from head to toe. And room after room of these patients who were one sicker than the next.
That's one thing that has been a struggle for, I think, all of the caregivers, is just to try to maintain a good head on your shoulders during all this, because everyone has lives outside of the hospital.
It was hard to try to keep it at work and not bring it home. My 4-year-old, I had to send her to my parents for when it started. Like, for about a month and a half, I didn't see her. It really tested my faith.
As the name implies, intensive care unit is quite intense. On any regular day, without having this kind of catastrophe pandemonium going on.
And each case of coronavirus depends from patient to patient. And so all of the care that we're doing medically is term supportive. There's not a cure for it.
We had patients that were terrified, crying. You could see the look of being so scared in their faces and crying to you. And you have to let them know that they're gonna be okay and that's what we're here for.
I could just see the terror in his eyes. I could see his blue lips. I could see his work of breathing start to slow, meaning he was tiring out. And that's when it is like, you gotta do it quick, because they might just stop breathing and become apneic and code. And that's a scary situation.
No one was there with the mom when she passed away, other than us as staff members. I was in that room for over an hour calling various family members across the state so that they could all kind of say their goodbyes. That was really heartbreaking.
There's this anxiety and fear of the unknown and how sick these patients are. And, it's really just a scary time. I'm a human being, I'm not a robot. I can't just go and do my job and leave. So yeah, really every day is a struggle. Every day is a challenge, and we just gotta rise above it.
And I just realized that I do have a passion for taking care of people that are in need, and just something that comes natural.
It's my job, but it's also my calling. It's one of the reasons of why I went into nursing.
That saying, if you find something you love, you'll never work a day in your life, could not be truer for me.
We're all working intimately together and doing our best to get through this.
Behold the candle, how it gives its light. It weeps its life away drop by drop in order to give forth its flame of light. Just one person, that one flicker of light for that one patient, then I've done my job. And I couldn't be more appreciative of the community allowing me to do just that.